Multiple sclerosis is a complex disease in which a genetic component interacts with environmental factors to cause the disease. So far, around 200 genetic variants have been associated with multiple sclerosis risk. However, genetic factors known to influence the disease course in patients who already have the disease are lacking. In this multicentric collaborative study published in Nature by the International Multiple Sclerosis Genetics Consortium, a genome-wide association study was conducted in DNA samples from more than 12,000 patients with multiple sclerosis. The study resulted in the identification for the first time of a genetic variant associated with the disease progression in patients with multiple sclerosis. The variant is intergenic and is located between a gene encoding a DNA binding thin finger protein and the dysferlin gene. Interestingly, patients who were homozygotes for the risk allele progress faster and needed walking assistance about 4 years earlier than patients who were heterozygote or homozygote for the wild type allele. In addition, patients who were homozygotes had also a higher number of cortical and infratentorial lesions who are known to have a worse disease prognosis. So the study first provided evidence that disease progression can be genetically mediated, and second, it may lead to a better understanding of the mechanisms underlying disease progression in patients with multiple sclerosis, and to the identification of therapeutic targets that can be the starting point for the design of new therapies to prevent disease progression in multiple sclerosis.